Imagine discovering a hard lump beneath your skin. You would probably arrange an examination, a scan, and perhaps a biopsy to learn whether it was harmless or cancer. Now place that same lump on the body of a mother living deep inside the Amazon rainforest. There is no laboratory, scanner, or specialist nearby. There may not even be a familiar word that separates cancer from every other illness that causes swelling, weakness, bleeding, or pain. At first, the lump does not hurt. She continues gathering food, preparing cassava, carrying water, and caring for her children. Weeks pass. The swelling becomes larger. Her appetite fades. She tires earlier, and a pain begins waking her at night. Together, these troubling changes could still resemble an infection, an old injury, a cyst, or several other conditions. That uncertainty is the first danger. Cancer is not one disease, and it cannot be confirmed by appearance alone. So how can people fight something they cannot reliably identify? The honest answer is that they fight the suffering they can see. There is no single Amazonian response, because hundreds of indigenous peoples possess different languages, beliefs, plants, and healing traditions. In this fictional community, an experienced healer begins by observing. The healer asks when the swelling appeared, whether it changes, where the pain travels, and whether fever or bleeding has begun. Family members remember details the sick person may have overlooked. They know when she stopped eating normally. They noticed when her hammock remained occupied after sunrise. They saw which movements became difficult. This shared observation becomes the community's first medical record. The healer may use preparations made from locally known plants to wash the skin, settle nausea, encourage sleep, or soothe discomfort. Some forest plants contain biologically active chemicals, and generations of careful knowledge can make certain remedies useful for particular symptoms. Relieving a symptom is not the same as eliminating cancer. A drink that reduces nausea does not prove that a tumor is shrinking. A paste that cools painful skin cannot reveal whether abnormal cells are spreading through the body. Without testing, nobody can even know with certainty that the illness is cancer. The family therefore fights in another way. Her daily work is divided among relatives. Someone prepares soft food when chewing becomes exhausting. Someone keeps drinking water close to her hammock. Children are watched while she rests. At night, a relative sleeps nearby and listens for changes in her breathing. She is not abandoned because she can no longer complete her usual tasks. Care becomes communal. That support may preserve strength, reduce fear, and help her remain connected to ordinary life. But community care has limits. If the hidden disease continues growing, kindness cannot remove it. The lump may break through the skin. Pain may spread into bone. Breathing may become difficult. And now the family faces the question that makes cancer different from an ordinary fever. What happens when every familiar remedy reduces the suffering, but the illness itself refuses to leave? When the illness refuses to leave, the meaning of fighting begins to change. The family is no longer responding to one lump. They are responding to everything the growing disease takes away. The first battle is food. Cancer can alter appetite, drain energy, and cause severe weight loss even when someone is still eating. The mother who once finished a full meal now turns away after several bites. So her relatives stop expecting her to eat like everyone else. They offer small portions of soft fish, mashed fruit, or familiar broth throughout the day. The goal is not to starve the tumor, cleanse the body, or perform some secret forest cure. The goal is to help her keep enough strength to sit up, speak, and remain involved with her family. Water becomes equally important. Fever, vomiting, diarrhea, bleeding, or simply eating less can leave a weakened person dangerously dehydrated. Someone keeps water within reach and watches whether she can swallow it. If she becomes confused, stops drinking, or produces very little urine, the family recognizes that her condition is worsening, even if they cannot explain why. The second battle is rest. Pain that grows at night steals sleep, and sleeplessness makes fear and exhaustion worse. Her hammock is moved to a quieter, shaded part of the home. Relatives adjust its position, so swollen or painful areas are not pressed against a hard surface. Someone remains close because severe weakness can make standing or walking dangerous. The third battle begins if the skin opens. An advanced tumor can sometimes create a wound that bleeds, leaks fluid, smells strongly, and attracts insects. This can be frightening, but the family does not treat her as dirty or dangerous. Caregivers use the cleanest materials available, protect the area from flies, and replace wet coverings when possible. They watch for increasing warmth, swelling, pus, fever, or sudden bleeding. Those signs may mean infection or another serious complication. Yet without antibiotics, sterile supplies, blood transfusions, or surgical care, their ability to stop those complications is limited. Then comes pain. Some traditional preparations may soothe discomfort or help the person relax, but their effects vary. Their doses may be uncertain, and some plants can be toxic. Natural does not automatically mean safe. Even a remedy used successfully for generations against fever or stomach pain may do nothing against severe cancer pain. Modern palliative medicine uses carefully selected drugs and professional assessment for a reason. Deep in this forest, those options do not exist. So comfort comes through position, shade, quiet, companionship, familiar food, gentle cleaning, and the constant presence of people she trusts. This resembles one part of palliative care, caring for the whole person rather than focusing only on the disease. But it cannot replace effective pain medicine or cancer treatment. The fourth battle is fear. Everyone sees her changing, and silence makes their fear heavier. Family members sit beside her, answer what they can, and allow her to speak about pain, death, children, and unfinished responsibilities. Depending on the community, a healer may use songs, prayer, smoke, stories, or ceremony. These acts cannot destroy malignant cells, but they may restore meaning, reduce loneliness, and remind the sick person that illness has not removed her place within the group. Each morning, the family measures progress differently. Did she drink? Did she sleep? Could she speak without gasping? Did the wound bleed? Was the pain worse than yesterday? These observations guide what the family does next, even though they cannot reveal the cancer's type or stage. The brutal truth is unavoidable here. Completely isolated people cannot truly fight cancer with the tools modern oncology uses. They can fight dehydration, hunger, infection risk, fear, abandonment, and unnecessary suffering. Sometimes the illness may be something treatable, and the person recovers. If it really is aggressive cancer, however, supportive care alone may not stop its spread. Weeks later, the mother can no longer reach the river. Then she can no longer leave her hammock. Her family has done everything their knowledge allows, yet the disease keeps advancing. And they now face the final question. If survival is no longer something they can guarantee, what does it mean to keep fighting? In this situation, fighting no longer means defeating abnormal cells. It means refusing to let the disease take everything before it takes the body. The mother is moved where she can hear the river and the mourning voices of her children. Food and water arrive before she asks, and someone remains beside her. When she can speak, people listen. When she cannot, someone holds her hand. Stories continue around her hammock. The healer keeps visiting, not because another ceremony is guaranteed to cure her, but because presence still matters when a cure is unavailable. Some days the pain eases. Other days it overwhelms every remedy the family possesses. No honest survival story should disguise that. Familiar food, cleanliness, rest, spiritual comfort, and human touch can reduce some suffering. But none of these should be presented as a proven cancer cure. Without reliable diagnosis, surgery, radiotherapy, chemotherapy, or effective pain medicine, many cancers become more dangerous and painful. The forest is not a secret oncology ward. So how do people deep in the Amazon fight cancer, far from hospitals? Often they fight without ever knowing cancer is the enemy. They respond to the lump, weakness, wound, hunger, pain, and fear. They reorganize the community around the person who is suffering. When the disease cannot be stopped, they fight abandonment. The person may weaken and die despite everyone's effort. Pretending that a plant or ritual guarantees survival would be dishonest and dangerous. Their courage lies in caring for someone when every day becomes harder. Modern medicine can attack the tumor. Community can defend the person. The tragedy is being forced to face cancer with only one of those defenses. Deep inside the rainforest, the family cannot promise survival. They can promise something else. Whatever happens, the mother will not face it alone.